Why do you never arrest the person with acne? Because they're good at breaking out. Terrible. Oh my God. How did I get a medical school? Hi guys, Dr. Tirgari here with Avalon Laser, and today's topic is going to be acne scars. Now this is going to be a general overview for you, so it's not going to be comprehensive, but I want to give you a little bit of education about different types of acne scars, how you generally treat them, and what you can do to educate yourselves so when you go and get this thing done and treated, you'll know a little bit more about how to approach this topic. Now the first thing I want to talk about before we talk about anything is what to do when you have active acne. You have to get acne under control. Treating acne scars when you have active acne is pointless, right? If you're going to treat acne scars, you want to make sure you get the source of the problem treated first. And we can talk about that in another video, and we're going to get that done. And there's going to be some information in the text below about how you can treat acne before you even tackle acne scars, because this is all important, okay? First thing is we're going to start with a joke. Why do you never arrest the person with acne? Anyone? Because they're good at breaking out. Terrible. Oh my God. How did I get into medical school? Let's not go there. All right. Let's talk about the different types of acne scars. All right, guys. I like to make it simple. I like to break into different categories. It's going to make it simple for you to address each one and know which ones actually pertain to you. All right. Let's talk about them one by one. All right. Here you go. 4 major types. All right. The first type is going to be pigmented scars. Now, pigmented scars are going to be because of inflammation from acne. Your body's immune system is going to attack the acne pustules. It's going to do all kinds of inflammatory things. It's going to, try to kill the bacteria, and it's going to leave some residue behind in the skin, which is going to be usually red or brown, usually red. So this pigmented scar can leave behind. It's kind of like dead bodies littered on the battlefield, if you want to go and think about that imagery right there. But this lingers after the acne is gone. And pigmented scars are their own specific category. Now we can talk about pigmented scars all day, every day, but how do we fix them? Well, some of the scars are superficial, some of the scars are deep. If you want to start by treating the scars, you want to get rid of this top layer first. And how do we do that? Well, pretty simple. You exfoliate the top layer of skin. And the way we do that is either with a microdermabrasion with a diamond or a crystal tip, or with a chemical peel. Now I like chemical peels because a lot of chemical peels actually have anti-acne ingredients in them. We use peels in our practice all the time. They work phenomenally well. They exfoliate the dead surface of the skin. If you happen to have active acne, they can target the acne at the same time, okay? So first start with peels. Second thing we start with is topicals. This is gonna be something you guys want to do at home. We actually use a lot of topicals in our practice as well. There's also some data also in the text below that you can actually use if you want to start learning more about what topicals might be useful for you. But topicals are a great way for you to do some home care and take care of those pigmented scars by yourself, okay? The third thing is gonna be lasers. Lots of different types of lasers. We won't get into that in this video, but lasers are fantastic for targeting pigmented acne scars. All right? Category number 2, depressed acne scars. Yeah, you got acne, you got depression too, right? You're depressed just like the scars are, duh. But in all seriousness, depressed acne scars is when the skin has suffered the inflammation from the acne, okay? The acne pustule has basically been removed, and some of the matrix of the skin has also been destroyed. And what happens when the acne is gone, the skin basically flattens, and then depresses, and you've got a concave, broad-based scar, which is where the acne pustule used to be, which is where the skin was eroded underneath. And you've got a little crater underneath, and that is the depressed acne scar. And this is also something that you want to look at and see if this applies to you. How do you remove the overall appearance of it? Same as in category number 1. You can start with a microdermabrasion or a chemical peel to reduce the top layers of the skin, which will reduce the concavity, which will reduce the appearance of the depressed acne scar. Now, this may not be enough by itself, okay? So this is a good starting point to reduce the appearance of the depressed scar. However, to really effectively target depressed, broad-based acne scars, you want to start either with a laser or with microneedling. I generally don't like home care microneedling products because they're just not that effective. They don't really go that deep, and you can't really vary and adjust the depth like you can with some of the more advanced microneedling techniques that are out there. You want to go see a skincare specialist. They're going to have some pretty good materials and machines that are in their practice. If they know what they're doing, they're going to know how to treat your acne scars, because not all acne scars are going to be the same. Some are deeper than others. You might want to use a different adjustable length of needle, and some of the better machines will allow you to do that, okay? So microneedling and a variety of different lasers can treat depressed acne scars, okay? Category number 3, you ready? Ice pick scars. Now this is kind of like a depressed acne scar, but not really. But these are more shallow, but also more deep. So they don't have a broad of a base, but they tend to go very, very deep, okay? Now you can microneedle these all you want, but they're not gonna respond as effectively, all right? What we find is something that we call TCA cross. This is a very, very aggressive type of chemical peel. We wouldn't do this all over the entire face, but when you actually apply it inside the ice pick scars, what it does is it kind of cauterizes the scar and causes it to close, right? So you can think of it as a kind of a deep well, and you're filling that well and cauterizing it and causing it to close, all right? Sometimes you have to do something on the surface of that well, and we can do that with microneedling and lasers, but we usually use this TCA cross technique very, very effectively in our practice for those really, really deep mine shaft scars, if you want to think of it like that, all right? The 4th type of acne scar is going to be a raised scar. This is also known as a keloidal scar. These are going to be really, really tough to treat, and I hate to tell you this, but this is going to be something you absolutely have to treat in the hands of an experienced provider. You can't really do a lot with this at home. Typically, these are going to respond. Sometimes you'll see some practitioners will try to excise them. I don't like that idea at all. I think that you're going to get the best results by injecting them with a corticosteroid. There are different steroids that people use, but generally speaking, what the steroid does is the steroid injection will cause that elevated scar to slowly shrink. You will require typically a few treatments, at least 1 or 2, and sometimes you'll have to come in for regular maintenance to keep that thing under control. Usually these types of scars are going to be in certain types of skin, right? Darker skin people tend to keloid more than lighter skin, but that's not always true, but it's kind of a general rule. So keloidal scars are the last one. Let's talk about some other treatment options for you, okay? It's at home. Now, generally speaking, a home care regimen is a must if you're going to get treatment for acne scars effectively. If you're going into the clinic or somewhere and they're not giving you something to go home with, you're not going to get the best results. And I usually love to start with a retinoid. Now, lots of different retinoids on the market, and I generally prefer to slowly wean people up. You don't want to throw somebody into the pool, and have them drown. You want to basically slowly wean them in so that their skin adapts to it, and you're going to get the best results, and you're not going to have to taper down the treatment, halfway through. Okay, the next thing I like to do is some sort of topical bleaching agent. We sell these in our practice. I formulate these in our practice, and they have a combination of different ingredients. Usually they contain some version of hydroquinone if you can tolerate it. I don't like to use hydroquinone for a long period of time, especially in darker skin. There are some complications associated with it. The best bleaching agents have a combination of different ingredients that work synergistically together to lighten the pigmentation, okay? This is a basic overview of acne scar treatment. I hope you found this video useful. Please take a look at the text below and like and share this video. We hope to see you in our practice if you're local. Otherwise, come visit our website to learn more about what we can do for you. Thank you so much. We'll hope to see you for the next video. Bye-bye now.